Hello, today I'm going to talk about depression. This video will cover the definition, the symptoms, the classifications and a brief outline of treatments for depression. In the UK, 2.3 million people suffer from depression. Depression is different from a feeling of sadness. This is because the symptoms of depression vary little from day to day. A person with depression may feel little happiness from events that would normally make someone happy. For example, winning a prize for a project. When taking a history from a person with depression, you must fully explore the symptoms. These symptoms can be divided into core, biological, cognitive, and psychotic. There are three core symptoms of depression. These are anhedonia, which means loss of interest in things that used to be enjoyable to a person. For example, someone who used to enjoy football can no longer be bothered to play. Low mood, and this should be present for at least 2 weeks. And low energy. In general, to diagnose depression, the symptoms should be present for at least 2 weeks. Biological symptoms include weight loss and loss of appetite. However, in atypical depression, there is actually weight gain. Loss of libido is also common. Early morning wakening is when someone with depression finds it difficult to have a good night's sleep and will wake up 2 hours earlier than they normally would. In atypical depression, a person may sleep more than normal, just like they may eat more than normal. A patient's low mood is normally most pronounced in the morning with depression. Cognitive symptoms include loss of concentration, negative thoughts, and thoughts of suicide, whereas psychotic symptoms include hallucinations and delusions. It is very important to take a thorough history from someone with depression. You must ask, have they ever considered taking their own life? This is a very important question as you need to assess suicide risk. It is also important to ask about elevations in their mood, because an episode of low mood could be the first presentation of another affective disorder, such as bipolar disorder. A patient may come to the hospital or to the GP talking about a low mood when in the past they have had high elevations of their mood. So bipolar is the diagnosis as opposed to depression. A common differential for depression is hypothyroidism, which will give symptoms of low mood, but also symptoms of hypothyroidism itself. Depression is commonly classified into mild, moderate, and severe. A mild depressive episode will include 2 core symptoms with 2 other symptoms from any category. Again, these should be present for 2 weeks, at least. A moderate depressive episode will include 2 of the core symptoms of depression, plus at least 3 or 4 other symptoms. Severe depressive episodes will include all 3 core symptoms, plus 4 other symptoms and possibly psychotic symptoms, such as delusions and hallucinations. In terms of treatment, the treatment of depression follows the biopsychosocial model, as the disease itself is multifactorial. Biological treatment includes the use of antidepressants, and antidepressants are discussed in another video on my channel. Psychological treatments include self-help therapy, CBT, and physical activity. Social treatments include social support groups. Antidepressants are not recommended first line for someone with depression unless they have had depression for a long time or they have had mild to moderate depression in the past. This concludes my short introduction to depression. If you liked this video, please don't forget to hit the like button and subscribe to my channel.